Okay, so let's jump right away to the introductory paragraph. Paragraph number 1. We started off by saying on January 29th, 2015, I left the oncology unit for the last time as I finished my final round of chemotherapy. The main goal that I had for that initial sentence is that it's the first thing that people are going to see. It's going to be the main thing that I can use to draw people's attention in to read the rest of my personal statement. And I wanted it to make a strong and sharp impact from the get-go. And me adding the details, the date, me leaving the oncology unit, it's not just me saying, on January 29, 2015, I got sick with cancer. Or on January 29, 2015, I finally recovered. I gave details and I talked about finishing my last round of chemotherapy. The last round of chemotherapy adds a sense of time. Like it's not just a one-time thing that I fought cancer and beat it. It's a prolonged battle, and this was finally my last round of chemo. So adding details like that and thinking about how you frame your sentence is really important to think about, especially for the first couple of sentences, because that's ultimately what draws viewers in, to make sure that they keep reading and they fully grasp, everything that you're trying to get across. After that, I said, although I triumphed over cancer, I grappled with severe deconditioning and peripheral neuropathy. Now, the main thing that I talked about with this was more so geared towards pm&r, the specialty that I applied into. And a lot of what they do and the focus that they have is not necessarily in the treatment of a certain disease, but more so in helping patients get their life back after, whatever disease or surgeries or illnesses that they've had. And that's why I talked about this sentence. Although I triumphed over cancer, although I was treated, I still had a lot of issues going on. And that transitions to the next sentence where I talked about me not being able to be myself until I started working with my therapy team. And again, that's just going back to what pm&r is and the main focus of pm&r. So this showcases that I've had something really difficult that I've had to overcome, and my experience with that showed me the impact of not just pm&r, but like of undergoing therapy and of medical specialists that focus on improving patient life and quality of life and not just treating a disease. My battle with primary mediastinal B-cell lymphoma guided me towards a career in medicine. However, my intellectual curiosity in the anatomic and functional manifestations of the neuromuscular system and my desire to help others get back on their feet, as my care team did for me, ignited my aspiration to become a physiatrist. So that is to just wrap the ribbon around the whole idea that I know what pm&r is. I have had experience with pm&r, and this is truly what the field for me is, and this is what I really want to do for the rest of my life. So that is what I would consider a very strong introductory paragraph, and I feel like a lot of that has to do with my personal experience dealing with cancer. But overall, I feel like I was able to really make a strong impact right away in a very concise manner. So moving on to the second paragraph. Throughout medical school, I worked as a recreation and activities director in a residential home for neurologically disabled adults. I collaborated with care team members to create goal-oriented activities tailored to each patient. So first couple of sentences, just giving a background of what I did during medical school to show that I continued to remain involved in pm&r and not just, I had cancer, I had to go through therapy to get my life back, this is why I want to be a pm&r. I showed that even in medical school, I continued to remain involved and learn more about the field through experience. And I emphasize especially collaborating with care team members, goal-oriented activities tailored to each patient, focusing on that individualization of patient care, because that's something that pm&r really focuses on. And then continuing on with the rest of this paragraph, just adding more detail and specifics about what I did and how it correlates to pm&r. So I talked about how with my patient that had cerebral palsy, he's not really able to participate in backyard games until I created something to help him, kind of participate and play in the games, even though it's not the same action of throwing a ball. He's able to at least move the ball on top of the ramp that I created, and it would roll towards the goal, or whatever you guys call that little ball is in bocce. But adaptive sports is a focus in PM&R, and me doing something like that shows that not only do I know what adaptive sports is, not only am I willing to help my patients out, but there's also an innovative side to me where I'm able to think on my feet to improve care and improve patient experience, which from my experiences doing rotations in inpatient rehab units, it's a very big deal. It's very important to be able to think on your feet and to really streamline and specialize care that you're giving to each patient individually, instead of just doing whatever is the generic policy to help patients out. It's really important to tailor care for each patient individually. And yeah, I end off that paragraph talking about many of these special encounters by helping patients overcome the limitations imposed upon them by their diagnosis, deepened my appreciation for PM&R. Again, tying it all back to the specialty. Now, with this third paragraph, this isn't really a paragraph that I feel like a lot of you guys would have. Hopefully you guys don't have these paragraphs, but this is me explaining a red flag in my application. This is me talking about my step one. And if we read through this paragraph, which I did in a previous video, you'll see that a lot of what I did in this paragraph is focusing on the positives, focusing on the comeback, not really making excuses for myself and saying that, spending the whole paragraph talking about this is why. No, this is me saying things like, this setback ultimately transformed me into a more mature care provider with greater understanding of how psychosocial factors affect patient lives. Boom, something that I learned through my setback. I've come to accept that life will present unforeseen challenges, whether it's a debilitating diagnosis like cancer or personal circumstances impacting performance on an important test. Boom, that's me saying that I understand that this is a part of life and that I'm resilient and that I can come back from this. So showing two things from something that is seen as a red flag. And then I also recognize my capacity to persevere and become a beacon of hope for my patients as they work to overcome challenges of their own. Boom, tying it back to PM&R, because in PM&R, the whole point is focusing on the comeback, not the setback. And this highlights that, because if I'm able to talk to my patients that I had cancer, I had a lot of things going on that caused me to fail an important test, but I didn't give up. I continued to persevere. I continued to fight through it. And with the help of my team and all of those that I care about, I was able to get to where I am now, a doctor. And, if you're able to ignite inspiration, ignite passion from your patients like that, they're going to get better and you're going to feel more rewarded and fulfilled from doing your job. So I feel like even though this is something unexpected, this is something that I didn't want to happen, you got to look at the positive and turn whatever negative you had into a positive. And I think that is something that's very, very important into the field that I'm going into. Okay, moving on to this fourth paragraph. This reflection ignited my aspiration to highlight my dual experience as a patient and a future healthcare provider. This is more of tying back to my first initial paragraph where I talked about being a patient and how I always wanted to be on the other side and help people get back on their feet. This is now me talking about what I'm doing to make that happen. With my background in videography and medicine, I welcomed the challenge of creating YouTube videos about my journey, from battling an illness that had once brought me to my lowest point to becoming an advocate for fellow patients and survivors. So now it's more of my transition from this is who I was, then I talked about what I wanted to become, and then boom, this is what I'm doing now to show that this is truly my passion, this is truly what I want to go into, and I'm already starting that path now. My videos amassed 50,000 plus views, and my story was featured by the Leukemia and Lymphoma Society with the hopes of inspiring others. The lasting impact of sharing my story has motivated me to make patient education and advocacy a priority. So this is more of now transitioning towards the future. Me talking about, the lasting impact of my story and how patient education and advocacy is something that I want to be involved in throughout my academic career. That's something that I feel like is a key point that I can provide and offer to whatever residency program is taking a look at my personal statement. So it's not just me talking about what experiences have I had that made me want to go into the specialty? What am I doing now to get into the specialty? It's also talking about what I will offer if you accept me to your residency program. And I feel like those are very important key components of a personal statement that makes residency programs take a look at you even deeper and really think about, do we want this applicant or do we really need this applicant in our program? So moving on to the fifth paragraph, I supported, like everything that I'm doing, and I also talked about my emphasis on research. I know for me personally, that's the strength of my application, is the amount of research that I've been doing. And me just adding a little bit more detail to what I already put in my activities section is, I feel like, worth it, because that is what I really want to highlight. And with my ultimate goal of matching into an academic institution, which I did, I feel like this really helped. So I continued to pursue the privilege of impacting patients on a wider scale through research. Again, referring to my previous paragraph of doing patient advocacy through social media, I continued that topic of helping patients on a wider scale and not so much as an individual one-to-one scale, which I will do as a physician. So through my work in the peripheral nerve lab, I did all of these cool things, added a lot of detail, and included the parts that are very relevant to PM&R. Talked about how my work is still in progress. I received awards from them, and how this process, this intersection of scientific discovery and clinical practice, inspired my goal to continue pursuing research and educating patients on evidence-based medicine. Again, even though I'm talking about research, my main focus is still being a clinician and providing patient care, and how I'm tying research into that. And to cap it all off with this last paragraph, it's just my conclusion on how I want to contribute to the program and to the field in general. I know a lot of programs sometimes would request one paragraph in specific that's just about them, to make sure that it's not a generic personal statement that they're getting, and that it's actually a very specific personal statement for their program. So, and here I talked about, as I envision my PM&R residency training, I'm eager to embrace the challenges of residency and grow as both a physiatrist and an academic physician. Again, me wanting to do research, academic. With my strong background in research and mentorship, I hope to join a program that will foster the optimal environment for my aspirations. That's me saying that I know what I want, and I know your program can offer it to me. I look forward to contributing my skills and experiences to the program, collaboratively working with others who share similar passions, and motivating my colleagues to rise in the face of the trials that lie ahead during residency. Me contributing to the program while I'm also taking a lot from the program and learning from them. So this is my generic personal statement, and I can go in detail about each of my personalized ones for specific programs, but the main thing that I wanted to talk about is make sure you research the program, bring up specifics about the program, and really tailor your last paragraph into why you're the perfect fit for that exact program. So, look up certain missions that they have, a specific lab that you want to join, specific research that they're doing that you want to take part in, specific, extracurricular activities that they have that's not offered anywhere else, and why you want to do it there. Sometimes you can even just focus on the location, talk about you have family there, and that having strong ties to the location means that you want to stay in that area and continue working in that area even after your training. Those are things that you can bring up in this last paragraph to make your personal statement even stronger. So yeah, and that concludes our analysis of my personal statement. Hopefully you guys can draw some things away from this, and thank you so much for tuning in. Peace.